What's up guys, welcome to Mom and Baby Wellness, and today we are going to cover a free training on how to take care of your newborn. So this is going to be very intense, and get prepared to watch this till the very end. So welcome back guys, my name is Nurse Terry and I'm going to take you through a free training on how to take care of your newborn right from the moment he or she is born. And you will get to know the basics, what you're supposed to do, what you can observe, what is normal, what is not normal. This is going to be in depth. So let's get started. When it comes to your newborn, there are some things that you may observe on its body that may be kind of not normal, especially if you haven't had a baby before. So when it comes to your baby's skin, so the skin may appear slightly dry and a little bit cracked than your skin, and this is normal for the first few days. So you do not have to worry about that because it will resolve within a few days. How about the eyes? So your baby's eyes may seem a little bit crossed, when it's born, but no, the baby's eyes should move together after about 3 to 4 weeks. So the baby's eyes should start moving together, the same way together after 3 to 4 weeks. If the eyes are still crossed, then make sure you take the baby to your pediatrician. How about the nose? So the baby's nostrils are narrow, so as a result of this, you may feel as if your baby is struggling to breathe, or then the nose is stuffed and things like that. And it's normal for a newborn to keep sneezing every now and then. This is not an allergic reaction. It's not something that should alarm you. This is something that is normal. How about your newborn's baby breathing? So your newborn's baby breathing may appear to be a little bit faster than your breathing. And it will, when you look at the baby's chest, it may seem as if they are panting. So this is normal, and it's not something that you should worry about. So those are some of the observations that you may make. And there's something else. So your baby's head. So your baby's head may appear, the shape of the head may appear a little bit awkward, but this is normal. So you can help the baby attain a better head shape by allowing the baby to lie flat on the back or via the tummy times, as we shall discuss later on. So for the baby girls, it's normal to find some vaginal discharge. This is because of the hormones from the mother. So this is not something that is abnormal. This is not something that should alarm you. It's actually normal. Don't over concentrate on that. Just wipe them gently and don't worry about it, because it should resolve after a few days. More for the babies to hiccup and sigh, especially after a feed. This is normal, and it's not something that should alarm you. So how about breastfeeding? So when your baby is born, we encourage that skin to skin touch while you're breastfeeding. This is because it promotes more breast milk production. So it promotes breast milk production. So that skin to skin touch, that contact will promote breast milk production. Also, when you're breastfeeding, make sure you latch properly. There are some videos that I've done previously. I've explained in depth about how to latch, breastfeeding positions. But basically, latching means, putting the baby's mouth nicely on your breast so that the baby does not suck in air, which can bring about, colic and all that. So latch the baby properly. I've also done lots and lots of videos about breastfeeding. There's a full tutorial about breastfeeding, how to breastfeed. In this case, make sure you breastfeed on one breast for about 15 to 20 minutes to make sure that you exhaust all the breast milk. So I highly also encourage you to watch that breastfeeding tutorial so that you may know everything about breastfeeding. There's also something else. When you're breastfeeding, make sure you burp the baby. Burp the baby halfway through the feed and after a feed. This is very important because it will help to expel any air that they may have swallowed when they are breastfeeding. So bath the baby and also make sure that you breastfeed this baby on demand. That is after every 3 hours. So if this baby is a heavy sleeper, make sure you wake this baby up so that they may feed on after every maximum 3 hours or 3 hourly. So that is about breastfeeding. So how can you know if a baby is full? So you can know a baby is full by observing or monitoring the number of wet diapers per day. So a baby who is well breastfed, day one, no, a baby who is only about 24 hours old should at least have one wet diaper in that day. So day two, they should have at least 2 wet diapers. Day three, they should have at least 3 wet diapers. Day four, they should have at least 4 wet diapers. And day 4 onwards, from day 5 onwards, they should have at least between 4 to 8 wet diapers. So from this, you should know that this baby is getting full or is no full, and you don't have to worry, they're hungry or something like that. So if they can have this number of wet diapers in a day, then this baby is full or they are well fed. Baby poop. So during the first day or day one of your newborn's life, you'll notice that this baby will have blackish, stretchy or sticky kind of poop. This is called meconium, and this baby's poop will tend to get wetter and yellowish and kind of seedy. So it will look like as if they're tiny white seeds or yellowish seeds inside there as days go by. So this is what you should observe from your baby's poop. How about the cord care or the cord stump care? When your baby is born, there's this area, the cord stump area, where there's a peg. In this area, this cord stump tends to fall off between week 1 to week 3. So all you need to do is keep this area dry at all times. Don't put the diaper up or don't pull the diaper up the umbilical cord. So make sure that the diaper is below that area so that when this diaper is full, it does not spread over to the cord stump. So make sure you keep this area dry at all times, and it should fall off within 1 to 3 weeks. So and something else, you don't need to apply anything in this area. Just keep this place clean and dry at all times until it falls off. Bathing. So when and how should you bathe your baby? So the frequency largely depends on you. So there are some moms who are more clean conscious than others. So for me, especially for me, once a day is okay. And there are some moms who like to give a bath in the morning and before bedtime. This is okay if that is what you like more. So the frequency, you are the one as a mother who is going to determine the frequency. So when you're bathing the baby, make sure that you lay the baby on a flat area. This place should be safe. So make sure that the safety of the baby is well taken care of. So place the baby on a safe place, flat surface. You can use clean, warm water to wipe the face, and then soapy water to wipe the rest of the body. You can place the diaper on during the bath to avoid mess and clean that diaper area the last. Now, if the skin is very dry, because we talked about the baby having dry and cracked skin, so if the skin is very dry, you can apply some petroleum jelly. You don't have to use the scented jellies, just use non-scented, and the soaps also should not be scented. So make sure that these products that you're using on your baby are non-scented. Also make sure that the room temperature is ideal to protect the baby from overexposure, because babies are vulnerable. So make sure that the room temperature is ideal, and especially when you're undressing the baby, make sure that the room temperature is okay for the baby. It's not too hot and it's not cold. So let's go through burping, because these are something that really disturbs lots of moms. So baby burping. So I've mentioned briefly about burping, and burping occurs, during the feeding sessions. So you burp a baby halfway through a feed and after a feed. So if you're using formula or breastfeeding, you need to burp this baby. And the burping positions are on your shoulder, or when the baby is in a sitting position, or on your laps. So you burp by rubbing the baby's back gently until they let out that gas through their mouth. So burping is very important because it will help protect the baby or prevent the baby from getting colic. Colic is, it's something that can keep you up at night because it will bring a lot of tummy discomforts for your baby, and you don't want this. So I've also covered a lot of burping videos. Kindly check them out. Baby weight. So let's talk about your baby's weight. So when your baby is born and maybe 2 weeks after, they tend to lose some weight. This is very normal. When you go for your postnatal checkup, you will notice that the baby has lost some little weight. So this baby should add this weight back after about that second week thereby. So on your 6 weeks checkup, this baby should have added weight, their weight. They should have added the weight. So do not worry about this initial weight loss, because they are going to catch up later on or pretty soon. So the baby afterwards should continue adding the weight gradually, and you should be concerned if the baby loses the weight. So if the baby is losing the weight instead of gaining, and it's way past the second week after birth, then kindly see your pediatrician. Baby cues. So there's some baby cues that you will notice, or you will learn about, or you will master as you continue being a parent. So crying can mean that this baby is uncomfortable. They need maybe a diaper change. They need to be fed. They are craving for some attention, some soothing. They need to see you. All this can mean lots of different things. So you're going to understand your baby's cues as time goes by. So you also notice that sometimes the baby may tend to look away. So they may look away if you're overstimulating them, or there's something, especially maybe some heavy sound that they do not like, some very bright light that they don't like. So they may tend to look away from the source of that overstimulation. Sometimes you may also see your baby arching their back, and this may signal to you that they are kind of uncomfortable. Especially these babies who have colic, they tend to arch their backs so much often, and this should tell you that this baby is kind of uncomfortable, a little, very much, pretty much uncomfortable, and you should act. So as your baby grows and as you master this art of parenting, you will understand a lot of baby cues, and these are very good at telling you what you need to do as a mother, meeting the needs of the baby, and so on and so on and so forth. So how do you soothe your baby? So you can soothe your baby through touch. Just put your baby down or on your chest and just gently stroke your baby's head or the neck area or the arms, and that is very, very much soothing. Human touch is very important. It also promotes brain development as well as even physical growth, because it helps in production of more growth hormone. So this is very important. Touch your baby as much as possible, because your touch is magical. It will help in brain development as well as the physical growth of your baby. So you can soothe them through meeting their needs through the baby cues. Can be breastfeeding, changing, giving that diaper change, or you can also rock them. Maybe they want to sleep and they are not able to sleep, or they are overtired. You can rock them to sleep. You can, there's also something else. When you're rocking a baby, make sure that you don't shake a baby. You know, shaking a baby violently may result in the baby's brain damage, and you don't want this. I did a video about, the shaken baby syndrome, and this occurs when you shake a baby violently, and you don't want to do this. You don't want to cause your baby's brain damage. So make sure that when you're rocking the baby or swaying the baby, to soothe them, don't over shake them. Don't shake them at all, because it is not good for their brain. So how do you promote your baby's development? One, I've talked about the human touch. Human touch is very important. I've told you it will promote their brain development as well as the physical aspect of growth. So touch them, give them that skin to skin touch, give them baby massage, especially when you're bathing them. Make sure you do that as often as possible. Also speak to them throughout the day. Explain what are you doing to them. Speak to them in that, that language. It's called, let me remember, it's called parentis. Parentis language helps to make the baby understand your language, or understand or master a language through the way the mother speaks. So you can talk to them like, something like, "Hi baby, I want to do this and this, I want to give you a diaper change, or I want to feed," use these voices high pitched, and it's not this baby language. So it's high pitched, and it's kind of, you're talking to the baby in the normal language, but in a more soothing, calm, simple manner. So through this kind of language, your baby will understand you more, and they will also master that language. Also make sure that you speak to them using one language. So don't talk to them today using Spanish, and then the following day you're right there speaking to them in English, and then the next time you're speaking to them in Italian. So they get confused. So you need to stick to at least one language until they can talk it out or speak it, and then you can move on to the next language. So you can also promote your baby's motor development through giving them tummy times. So tummy times, it's where you lay the baby on their tummy for a few seconds initially, and then progress to about 3 to 5 minutes as the baby gets used to them. So when you put the baby on their tummy, they'll tend to place their elbows or their arms and try to lift themselves up. Through this, they'll be building their muscles on their arms, and they'll be helping themselves to gain more strength, as these will be very, very important when they are starting to crawl or even to stand, because they're exercising their legs or all the limbs all together. So give tummy times, and these have to be monitored. They have to be monitored. Do not leave your baby on their tummy and then go and do other things. These tummy times have to be monitored at all times, and they are short timed. So start with a few seconds, then progress to a few minutes, and do not exceed that 5-minute mark, because this is a newborn baby as we are discussing about. So monitor them. They have to be supervised at all time, because this baby cannot lift their heads nicely. They do not have the full head control, and so you have to be there to assist your baby. So these tummy times, they will help you. They will help the baby to improve the core strength of their bodies, and these will be very important as they grows up, as they learn to sit up, to stand, to crawl, and do all those motor activities. Talk about sleep. Sleep is something that really, it's a topic that is very, let me say, it's a topic that touches many parents. This is because some are not able to sleep well at night. The babies wake up frequently. Your baby cannot sleep well at night. The baby keeps crying at night, and you're kind of going crazy. So I'm going to give you a few tips on how you can help your baby adjust to sleeping more at night than during the day. So when the baby is born, they do not differentiate between day and night. They have no idea what a day is or looks like, and they have no idea or when a night starts or how it looks like. So you're going to help them understand or know, because babies learn very fast. So as a mother or as the general or the caregiver, you're supposed to help them differentiate between these two. So during the day, keep things bright, or include things that are, make sure the environment is very bright, it's vibrant, and there's some noise. No, it's not quiet, it's some noise and some activities going on. So this will keep their brains more engaged, and even if they will fall asleep very often, they will know that no, this time of the day when it's very, it's bright and we are kind of busy during this time. So how about the night? During the night, set this night scene or the sleep scene. Make sure the lights are dimmed. Make sure that it is calm. The environment is calm. There's no noise. You're not speaking loudly. You're speaking just calmly, and you're not over engaging this baby during the night. So when you do this, also include the various types of white noise. There are some white noise machines that you can invest in, or you can sing lullabies or read a story in a calm approach, and this will also signal to the baby's mind that this is a different time of the day, this night. And during this night time, this is what happens. You can establish a simple bedtime routine, and from this bedtime routine, this baby will learn that this is what happens, and then we sleep, and these events occur just prior to us going to bed. So this baby will get used to this, and they will eventually learn the difference between night and day. So during the day, this newborn baby will know, or you should encourage this newborn baby to sleep for at least after at least 1.5 hours after they wake up. So a newborn baby should sleep between 18 to 23 hours a day. So don't keep this baby up for so long during the day, thinking that they will sleep more at night. If you do so, this baby will tend to be more fuzzy, and you don't want that. So make sure the baby has enough daytime naps, and do as I've told you, help them differentiate between night and day, and due to this, they will be able to sleep more at night. As this baby grows, you should include some sleep training techniques. There's a method I have for you. It's linked below this video. So as your baby grows and reaches about 3 months, you should start sleep training them. There's a sleep training technique below this video. Kindly go and check it out and make sure you utilize it, because it has helped over 13,000 moms. So I believe it's also going to help you a great deal. You call your doctor. When should you call your doctor, or what should you see, and you feel like this needs a doctor's attention? So if your baby vomits, and not just the normal vomit, but the explosive or the projectile kind of vomit, the vomit that will tend to like jump off your baby's mouth, and this vomit is greenish in color, is something that should alarm you, and you should call your doctor immediately. Also, if your baby's temperature is higher than it should be, about it's above 37 degrees, call your doctor. Also, if your baby's skin turns bluish, especially on the mouth or on the chest area, also call your doctor. If the skin turns yellowish, this is called jaundice, and you're not in the hospital, then call your doctor immediately. There's also something else. If your babies, you cannot wake your baby up, they tend to be, they are floppy or unresponsive, also call your doctor.